Red light therapy, RLT, a groundbreaking treatment in the realm of health and wellness, harnesses the power of low-wavelength red light to penetrate the skin and promote cellular repair and energy production. This non-invasive therapy, rooted in decades of scientific research, has gained prominence for its ability to heal, rejuvenate and relieve pain without the side effects associated with traditional medical treatments. The mechanism behind RLT's effectiveness lies in its stimulation of mitochondria, the powerhouse of cells, thereby enhancing the production of adenosine triphosphate, ATP, and fostering cellular repair and regeneration. A notable study published in the Annals of Biomedical Engineering highlighted the therapy's efficacy in improving skin complexion and increasing collagen production, underscoring its potential in both medical and cosmetic fields. Today, RLT is known not only for its skin health benefits, but also for its broader therapeutic effects, including reducing inflammation, alleviating pain, and speeding up muscle recovery. As research continues to evolve, RLT is becoming an increasingly popular and scientifically backed option for those seeking alternative health and wellness therapies. The science behind RLT delves into its interaction with our body's cellular mechanisms, particularly focusing on mitochondrial function and adenosine triphosphate, ATP production. Red light therapy is now used in the treatment for depression, anxiety, and other mental illnesses. More on that later in the video, so watch to the end to find out more. Also, make sure to check out the links in the description for our most popular recommendations for natural weight loss, detoxing, improving memory, joint pain, brain health, and boosting energy levels. ATP serves as the primary energy currency of the cell, fueling various biological processes. RLT emits specific wavelengths of light, typically between 630 to 670 nanometers, nm, and near-infrared light around 810 to 850 nanometers, which penetrate the skin to different depths and are absorbed by mitochondria. This absorption stimulates the mitochondria, enhancing their efficiency and increasing ATP production. One pivotal aspect of RLT's scientific basis is the concept of photobiomodulation, PBM. This process involves the light-induced modulation of cellular behavior, leading to various therapeutic effects. Research, such as that published in the Journal of Photochemistry and Photobiology, indicates that PBM can lead to increased circulation, anti-inflammatory effects, and enhanced tissue repair. A notable study in the journal Lasers in Surgery and Medicine demonstrated that near-infrared light significantly improves skin complexion and collagen density by promoting collagen synthesis, a key factor in skin elasticity and youthfulness. RLT's effectiveness extends beyond skin health. Studies in the American Journal of Physical Medicine and Rehabilitation have shown that RLT can accelerate muscle recovery and reduce exercise-induced muscle fatigue. This is attributed to the enhanced cellular respiration and energy production, which help in quicker recovery and regeneration of muscle tissues post-exercise. These scientific findings underscore RLT's potential as a multifaceted therapeutic tool, capable of addressing a wide range of health concerns by targeting the body's innate healing mechanisms. RLT, also known as low-level laser therapy, LLT, or photobiomodulation, PBM, utilizes specific wavelengths of red to near-infrared light to penetrate the skin and promote cellular repair and regeneration. Unlike UV light from the sun, which can damage the skin, RLT delivers beneficial light energy at a safe wavelength range. The therapeutic effects of RLT are attributed to its ability to stimulate mitochondrial function in cells. The origins of RLT can be traced back to the 1960s, with pioneering work by Andra Mester in Hungary, who discovered the potential for light to stimulate hair growth and wound healing in mice. Since then, the application of RLT has expanded significantly, supported by a growing body of research. Today, RLT is used in various medical and cosmetic treatments, ranging from acne and wrinkle reduction to muscle recovery and joint pain relief, highlighting its versatility and effectiveness as a non-invasive therapeutic option. Please subscribe to support the channel and leave a comment saying "I subscribed," and I'll personally reply to your comment. Red light therapy, RLT, offers a plethora of health benefits, substantiated by an expanding body of scientific research. A primary advantage of RLT is its remarkable skin rejuvenation capability. Studies, including those published in the Journal of Investigative Dermatology, have demonstrated that RLT can significantly improve skin complexion, reduce fine lines and wrinkles, and increase collagen production, contributing to the overall youthfulness and elasticity of the skin. This anti-aging effect is attributed to the stimulation of fibroblasts by red light, enhancing collagen and elastin synthesis. Beyond cosmetic improvements, RLT is acclaimed for its therapeutic effects, particularly in wound healing and inflammation reduction. RLT accelerates the healing process of skin lesions and burns by promoting cellular repair and regeneration. Its anti-inflammatory properties, documented in the Journal of Photochemistry and Photobiology, are beneficial for managing conditions like acne, psoriasis, and eczema, offering relief without the side effects commonly associated with pharmaceutical treatments. RLT's benefits extend to pain management and muscle recovery. A systematic review in the American Journal of Physical Medicine and Rehabilitation reported that patients experiencing musculoskeletal pain observed significant relief after undergoing RLT treatments. Athletes have also found RLT advantageous for muscle fatigue and recovery. The mechanism behind these effects involves the reduction of inflammation and increased circulation, facilitating quicker recovery times and enhancing physical performance. These varied health benefits make RLT a versatile and valuable tool in both medical and wellness settings, providing a non-invasive option for improving skin health, accelerating healing, and alleviating pain with minimal risk of side effects. RLT is not only celebrated for its health benefits, but is also renowned for its practical applications across various settings. From professional medical offices and therapeutic clinics to spas and home environments, RLT devices offer versatility and ease of use. Professional-grade RLT treatments are typically administered in dermatology clinics or specialized wellness centers, where precise dosages and specific wavelengths can be tailored to individual needs, optimizing therapeutic outcomes for skin rejuvenation, pain relief, or muscle recovery. The accessibility of RLT has significantly increased with the advent of consumer-friendly at-home devices. These range from handheld units and wearable devices to full-body panels, making daily RLT sessions convenient and cost-effective. Innovations in technology have led to devices that are not only more affordable, but also equipped with features to ensure safety and efficacy, such as timers and adjustable intensity settings. For skin health, sessions might last from 10 to 20 minutes, focused on the face or other target areas, and for muscle recovery or pain management. Treatment times and frequency can vary based on specific conditions and goals. It's important for users to follow manufacturer guidelines and consult with healthcare professionals to maximize benefits and minimize risks. The ease of use and the non-invasive nature of RLT have contributed to its popularity among consumers seeking alternative or complementary treatments for a wide array of health concerns. As research continues to evolve, the practical applications of RLT are expected to expand, further integrating this innovative therapy into everyday wellness practices. While red light therapy, RLT, is widely regarded for its safety and efficacy, it's essential to consider potential risks and ensure proper usage to maximize benefits. RLT is generally considered safe, with minimal side effects reported. However, users should be aware of the importance of using RLT devices correctly to avoid potential risks, such as eye damage from direct exposure to the light. It's advisable to wear protective eyewear, especially when using RLT devices designed for facial treatments. Selecting a quality RLT device is crucial. With the market flooded with an array of products, consumers should look for devices that have undergone clinical testing and are FDA approved to ensure safety and efficacy. It's also important to check for specific wavelengths that match the therapeutic needs, as different conditions may require different light spectrums for optimal results. Individuals with certain medical conditions or those taking medications that increase light sensitivity should consult with a healthcare provider before starting RLT. There's a consensus among experts that while RLT presents a low risk for adverse effects, personalized consultation can help tailor the therapy to individual health profiles and avoid potential contraindications. Despite these considerations, the therapeutic potential of RLT, coupled with its non-invasive nature, makes it a compelling option for those exploring alternative treatments for skin rejuvenation, pain relief, and muscle recovery. By adhering to guidelines and selecting quality devices, users can safely incorporate RLT into their health and wellness routines. The future directions of red light therapy research and application hold promising potential for both medical and cosmetic fields. As the body of evidence supporting the efficacy of RLT continues to grow, researchers are exploring new therapeutic applications and optimizing treatment protocols to enhance outcomes. Current trends indicate a growing interest in the use of RLT for neurodegenerative conditions, mental health issues such as depression and anxiety, and the management of chronic diseases. One of the most exciting areas of research involves the application of RLT in treating brain disorders. Studies, such as those referenced in the journal Neurobiology of Aging, suggest that RLT could potentially slow the progression of Alzheimer's disease by reducing amyloid plaques and tau proteins in the brain, markers closely associated with the disease. Preliminary studies on the effects of RLT on depression and anxiety have shown positive outcomes. indicating its potential as a complementary treatment for mental health conditions. Before the last section, make sure to check out the links in description for natural weight loss, detoxing, improving memory, brain health, joint pain, increased libido, and boosting energy levels. Advancements in technology are expected to make RLT more effective, accessible, and personalized. Innovations may include the development of wearable RLT devices tailored to individual needs, allowing for more precise and convenient treatments. Additionally, the integration of artificial intelligence will lead to smarter systems that adjust wavelengths and treatment durations in real time based on user feedback and progress. The ongoing research and technological advancements promise to unlock new possibilities for RLT, making it a key player in the future of healthcare and wellness. Want to know all the powerful benefits of apple cider vinegar on the body? Watch the video above.